Incredible opportunity for Wayne State University students. My name is Jessica and I am the co-vice president of Club Med Virtual. I will be leading today's session, reading any comments posted in the chat and facilitating the conversation as we go along. Before we start, I just want to remind everyone to maintain proper etiquette and please keep themselves on mute unless Salma specifies otherwise. If you have any questions, please post them in the chat and we will address them as we proceed through the session. A Google survey will be administered for Wayne State University students at the very end of the session to verify your attendance. And we will close the survey in 30 minutes after the session terminates. So please stay on the call for at least 5 minutes after the session is over to ensure that the survey is working for you. This session will also be posted on YouTube in case you are unable to attend or want to revisit certain topics Selma discusses today, but you can't receive any attendance hours if you are not present in the call and complete the survey. So whenever Selma is ready, you can start.
Okay, hi guys. Thanks Jessica for that introduction. I'm gonna start sharing my screen with you. Okay, so I'm also gonna turn my camera on just so you guys can get a little better view. Okay, so hi guys. Can you guys all hear me?
Yes.
Okay, cool. All right, so I'm gonna show you a little bit about me. I'm gonna make this full screen actually. Okay, so my educational background. So I have a bachelor's of science in public health from Wayne State University, and I got my degree, I believe 2019 or 2019. So I finished my undergrad in public health from Wayne State. Maybe like I finished it August and I got into pharmacy school like the October before that. So I literally finished, I think I finished my undergrad degree a week before school started. Like I was like done with my last class and everything like that. So a week before pharmacy school started. So I did that. For pharmacy school, honestly, you don't need a undergraduate degree. You can just kind of do your 3 years of like prerequisites and take your PCAT and then go into pharmacy school. But I wanted to get a degree just because I don't know, I just felt like I had the extra time because I took my PCAT in my senior year, and then I thought I would, because a lot of people in pharmacy school you'll find that have don't really have a bachelor's degree and they kind of just did their 3 years. So having a bachelor's degree will make you stand out. There are some people in my class who have like master's degrees and then they go into pharmacy school. So it just kind of depends on what you want. And then honestly, after pharmacy school too, after your first year, I don't know if you guys heard about this, but you do get a bachelor's degree from Wayne State too. It's a bachelor's of health science with a concentration in pharmaceutical science. So I completed my first year, and then at the end of your P1 summer, you get a bachelor's degree too. So I mean, if you come in with a bachelor's degree and then you already get one, you kind of already have 2 bachelor's degree. And then when you finish pharmacy school, you get a PharmD as well. And I'm currently a 2nd-year pharmacy student at Eugene Applebaum College of Pharmacy and Health Sciences. So it's a long name, so just call it pharmacy school. And yeah, I'm interested in ambulatory care pharmacy or emergency pharmacy. So I'll talk a little bit about those later on. So my undergraduate experience. So I think some of the things I wish I knew before I got into undergrad was to not take it too seriously and kind of enjoy undergrad, because once you get into professional school or graduate school, you it gets a lot more intense. So I feel like during undergrad, I could have chilled out a little bit, but not to say that grades are important, because they really are, especially if you're planning on applying to a professional program. So it is important that you take it seriously, and it is important that you do your part, but just don't forget to have a little bit of fun too. And for undergraduate experiences, I would say before you apply, and like a lot of people are looking for like shadowing experiences and volunteering and stuff like that, you want to do stuff that are meaningful to you. So every person next to you is going to be like the same application. You know, I worked at a pharmacy, I did this, I did that, but having something that makes you stand out and something that you can talk about while you're at your interview for pharmacy school is going to be super important, because they're going to ask you to talk about, okay, so you on your CV, it says that you shadowed this person. Tell me a little bit about that. So you're going to want to have a story to tell or something to tell where you can make sure that it's meaningful to you and make sure that you stand out from everybody else. So also, I personally didn't work in a pharmacy in undergrad. I did I worked other jobs, but not in a pharmacy. And I thought going into pharmacy school that would kind of, like I wouldn't get in because a lot of people have work experience and stuff like that. But honestly, it's important. It'll give you an edge if you do work at a pharmacy, but it won't make or break you. So I got into pharmacy school and I didn't work at a pharmacy. Like I didn't have prior work experience, and you kind of get that work experience and you get that while you're in pharmacy school. So you don't necessarily have to have that, but you do want to make sure that you have, you don't have to, but it's good to have some sort of work experience just because, like it's when you go into your interview, they ask you like, oh, what work experience do you have? And how does that relate to you as a person? And they ask you these kind of questions and you want to be able to like have good answers for them. So it's also important to have that kind of thing. And if you do have a job before you go into pharmacy school, you want to make sure you have like good relationships with your employers. Um, you want to make sure that your boss and your colleagues and stuff have always good things to say, so maintain professionalism while you're at work. Yeah, so the most valuable experiences to have, I thought, were I had a lot of shadowing experiences. So I would go to like the hospital, or I would go to like different pharmacies, and I would kind of shadow them and see the different sectors of pharmacy that they have. And yeah, I think that's really important to have, because once you get into pharmacy school, and when even before that, when you have your interview and when you're doing your application, it's really important to talk about the fact that pharmacy isn't just, you go into CVS or Walgreens and they just count your pills and give you your medication and you leave. There's a lot more to it that I feel a lot of people either don't know, or they don't like it's kind of overlooked. So I think it's important to have. And then volunteering is also important. So what I did is that I like to volunteer in my local community, so I did a lot of that. And then you want to make sure you have hobbies and interests outside of pharmacy. I remember during my interview, they asked me like, what else do you do besides like just pharmacy or school related things? So you want to be able to tell them like, oh, I like bike riding, I like reading, I like watching movies, something to have like to show that you're a well-rounded person. So these are my personal undergraduate experiences. So for me, I don't know if medical students do this, but for pharmacy, they make you, for Wayne State at least, they make you like upload your CV online as well as with your application. So I recommend that everybody starts a CV really early on. So I think I started my CV like senior year of high school. So I think it's important to like just it's kind of just something to keep a record of what you've done, who you've done it with, the years, like your involvement in certain things. So it's always important to have someone look over your CV as well. So my mentor in the pharmacy world, she looked over my CV. My sister, she was really good with that kind of stuff. My professors, I had them look over my CV. So I think maintaining a CV is really important. And in pharmacy school, actually, when you get in, they make you have a CV, and like it's one of our classes. We have to upload our CV and like add things to every semester. So it's just important to kind of have a template before you even go in, just so like you have a track record of what you've done throughout your years. And then what I did, I talked about this a little bit. So I shadowed different sectors of pharmacy and pharmacists in various professional settings. So I shadowed an ID specialist pharmacy, which is infectious diseases. I did retail pharmacy, outpatient, inpatient at the hospital, like an IV specialist pharmacy. So it's like in a sterile room where they do chemo drugs and stuff like that. So there's a lot of different routes you can take with pharmacy, and I think exposing yourself and knowing early on what you think your interest might be is really important. I was also part of the Health Pro Start program, which I believe they ended it at Wayne State, I think. When I was an undergrad, it was a program where you apply from high school and then you get in, and it guarantees you a spot in pharmacy school from undergrad. So you have to score a 50th percentile on your PCAT and like maintain a certain GPA, and then you're guaranteed admissions to pharmacy school, basically. I mean, you obviously have to pass the interview and stuff like that. So that was part of the honors college that I did. It was a really good program because when I got in, we had a class that was required for us to take where they would, it's kind of like a little seminar. It was only me and 8 other students, I think. And we had different pharmacists come in and they would just like talk about their experiences. So we had an ambulatory care pharmacist, which is ambulatory care. If you guys don't know, it's kind of like I didn't know when I got into pharmacy that it was when I was an undergrad. I didn't know what it was. So it's basically kind of like an outpatient clinic. So it either be attached to the hospital or like outside the hospital. And then the pharmacist kind of runs the whole show. So you're under a delegated authority from a doctor, but you have your own patients, you have your own office, they come and they see you. You can prescribe certain medications, not all, but like certain medications. It's the same patients that you have. So it's not like a retail pharmacy where you're just seeing like all these different patients come in and take their medication. It's you're kind of following up with like either kidney transplant patients or liver transplants or like different patients in like different settings. So it's kind of just you're in an ambulatory care setting and like so you see different patients and you see like this is my like you kind of it's kind of nice because you're almost not really a doctor, but you have the same patients that you see all the time. So that was really cool to see. We had an ER pharmacist like come and talk to us too, which I thought was really cool because I didn't know like ER pharmacists were a thing. So it's actually really fast paced. It's kind of like you're with the coding team, like when someone codes in an ICU setting or whatever, the pharmacist is on that team, and you have to be really quick on your feet and like know the medications and stuff like that. So that's interesting if you're into that fast paced kind of stressful life. So yeah, and then like I said, I volunteered in my local community. I was really into like soup kitchens and like volunteering every Saturday at the mosque. So I would go and do that. During like our like Ramadan, like religious holidays, I would volunteer with the mosque and like just kind of, just give back to my local community. And like I said, actually, my mentor in pharmacy school told me this. Whatever experiences you have, make sure that you have a story to tell and make it meaningful. So he said, even when you graduate pharmacy school, like when you start applying for jobs and residencies and stuff like that, you want to make sure that when they ask you about something on your CV, that you probably like maybe you talked it up on your CV, that you actually have a story to go with it. So I'll give an example. Like right now, I volunteered at a COVID testing site because they needed like student volunteers at Wayne State. So when I put that on my CV, I want to make sure that I can tell them like, yeah, during this pandemic that was going on in the world, like I did my part and I went and I kind of not risked my health, but I put myself out there as a frontline worker and I was testing people, making sure they're okay and stuff like that. So it's important to do experiences that you can personally talk about and talk about your involvement and how it shapes you to be a better and well-rounded overall pharmacist in the end. So the application process. So I think a lot of people are kind of scared about the application process, and I
Sorry,
know I was when I first applied. So the first
sorry
thing you
to
want to do.
interrupt, but we had a couple questions in the chat that I don't want to move on to the application process and then
Okay.
to address these afterwards, but someone asked, why were you interested in majoring in public health?
Okay. That is actually a really good question. Honestly, if you want like the real answer, so this is how it actually happened. I was there's no like I don't have like public health spoke to me or like I don't like it's not I was really interested. I honestly had no idea what public health was before I got into it. And I was already sitting in the UGL, I remember, and like me and my friend were kind of like we had like a year left. I had already applied to pharmacy school and I was like, I want to do a degree. I don't just want to like work or whatever. So I would have finished my undergraduate degree in that year. Like if I had taken that extra year, I would have done a degree. So I was like, let me see what I think could be related to pharmacy and that was something that would give me an edge. Because a lot of people go into like a bachelor's of science, a bachelor's of bio, chem, stuff like that. So I didn't want to be kind of not, I don't want to say basic, but I wanted to stand out from everybody else. And honestly, I'm pretty sure, yeah, I am the only one in my pharmacy class right now that has an undergrad degree in public health. And I don't know, I was on degree works and I was just like trying different things and I was researching and public health seemed like it really correlated with pharmacy. It doesn't look like it does correlate, but it really does because understanding how medications affect people and understanding like right now in this pandemic that we're going through, epidemiologists and like different people who are involved in public health are extremely like involved in the graphs that you see, the curves, all that kind of stuff that we're reading about with COVID, those are done by public health specialists. And so having that edge of being a public health specialist and being a pharmacist too would just make you understand how society works better as a whole, I think. So yeah, that's like, I mean, the overall like answer is kind of just, I was in the UGL and I kind of just was like playing around with like seeing what I could do. But honestly though, I did do my research and I did kind of decide to see what I think would benefit me in the long run. And I don't know if you guys know, but once you get into pharmacy school, there's actually a bridging program between the master's in public health and a master's in business if you're interested in that too. So, so I'm in my 2nd year pharmacy. So in my 3rd year, you start picking electives of pharmacy. So you can take a public health route. So you could actually be like if you do decide to do the bridging program, you can graduate pharmacy school with a associate's degree in public health. So all your electives are going to be public health geared, and that will give you like an awesome edge over everyone else because you're going to graduate with like a bachelor's degree, a PharmD, and an associate's degree in public health too. So if you do choose to complete your master's in public health, you can do that, and it'll only take I think half a year to finish after that. So I just thought they were like super related.
Okay, someone else asked, why are you interested in becoming a pharmacist? Why choose pharmacy over other healthcare careers such as nursing, PA, medical school, dental school?
Okay, so this they literally asked me this exact same question when I was doing my interview for pharmacy. There's always like the generic answer, like, oh, I want to help people and whatever, which you can help people in like doing PA or nursing or dentistry and stuff like that. To be honest, my mom is a pharmacist, so I've been around pharmacy literally my entire life. Like since I was a kid, I would like go and wait for her like the hospital, and like she's always been in that kind of setting. So I guess I was exposed to it really early on, and I really like science. I know I wanted to go into something where I like really helped people and I could do the most I can like in my setting, I guess. I'm honestly not a fan of chemistry, so I was kind of a little bit scared because everyone says, "Oh, pharmacy and chemistry are related." I didn't like orgo. Gen Chem was okay. I hated orgo 1 and 2. It was like my worst nightmare. But I didn't like chem, so I was like, I don't know if pharmacy is like for me and whatever. But the more honestly I was exposed to it, and the more I shadowed and like saw pharmacists, the more I really wanted to be a part of it because it's not where you don't have no patient contact because that's not true. You're heavily involved with like the patient process and like getting them better and discharging them and getting them to the hospital, making sure that their medications are aligned with their disease state and everything like that. You're very heavily involved in that. But to me personally, I didn't want my career to be my life. I think my career is super important to me, and I would want to do everything to like to work towards that, but I didn't want it to be where I couldn't have like a family later on, or I couldn't do this or I couldn't do that. So I think pharmacy was a good mix between the two. For most part, pharmacy, the hours are like 9 to 5. You're kind of just, you go home after that. You don't really take your work home with you. So I thought it fit my lifestyle. That's what I want to say. Yeah, it's basically the short answer. But I think the more you expose yourself to pharmacy, and nothing wrong with retail pharmacy, nothing wrong with like CVS or Walgreens. It's just, I don't think it's for me because I'm Canadian. So I know in the States, a lot of the like the CVSs and Walgreens, it's very fast paced, and like you're a pharmacist based on how many scripts you do in the day. And like you don't really see patients, you don't really talk to them. It's a little bit different here in Canada. It's more patient centered, I think. So I think that working in a setting where you're the most accessible healthcare provider to people because you're literally right there. So every patient comes and they talk to you about their problems, and you have that relationship with them is super important to have and to maintain. So I'm also, yeah, I'm Canadian. So if you guys want to know about like the process of like, I don't know, how to like apply and like all that, there's a bunch of like extra stuff you have to do as a Canadian to go to Wayne State. So I can help with that if anyone wanted to know.
Awesome. If we get time more later on, then we will go back to questions, but you can start on the application process.
Okay, cool. So when I applied, the first thing I did was I watched for deadlines, and I wanted to apply in the early cycle. So I'm going to talk a little bit about that. So I only applied to Wayne State because I know I wanted to like stay in the area and like my family lives here. I didn't want to move abroad. So the early admissions for Wayne State is a when you apply early admissions for any school that has that option, if you get into that school, it's a binding contract. So you can only go to that school. Like you get interviewed and you go to that school and you can't apply anywhere else. And if you do, like say, for example, you applied to Wayne State early decision, you got in, but then you thought about it and you're like, wait, I want to apply to U of M. What if I get in? And you apply to U of M and you get in. First of all, it's gonna look really bad because technically you're in a binding contract and you shouldn't, like you have to go to that school that you apply early. So unless you really want to go to Wayne State or really want to go to U of M, I wouldn't recommend doing the early cycle unless you really know where you want to go. So, but the good thing about the early cycle, the early admissions, is that for Wayne State, for example, it's they take about 80% of the people who apply, or like 80 to 90% of people who apply early admissions. Wayne State takes them. So you could have, I know people that like their PCAT score wasn't like the highest. They did okay, they did average, and their GPA was also okay. And they got in because they did early admissions. You know what I mean? It gives you a better chance if your grades and your PCAT isn't like 90th percentile or whatever it was. Like, so it's just and plus you kind of know early on that where you're going, and it's if you know what you want and you know what school you want and you know like this is the place that I really want to go to, I would really recommend doing an early cycle just because it kind of guarantees you that admission early on. And yeah, so the first thing I did was I said, like, I watched for deadlines and applied early admissions. And then I reached out to professors and my professional employees and like my mentors and stuff like that for letters of recommendation. I know Wayne State requires one letter of rec from your professor and then another one from your like an employer or something. So that's what I did. I think I got one from my biochem professor, and then I got one from my like my mentor who I shadowed. So those are the two letters of recommendation I got. And then when you apply on, I think it's FarmCast, you don't actually get to see the letters of recommendation. So the professor, it goes from the professor to the application cycle right away. You don't really see what they say about you or anything like that. But yeah. So my personal statement, I actually worked on it for a really long time. I remember I really wanted, I didn't want like a generic personal statement where like, oh, I want to do pharmacy because I want to help and, you know, that kind of stuff, which is, it's fine to do. But I kind of wanted to make my personal statement like actually personal. And I wanted to relate different things from my upbringing and different things from like my life into how it shapes me to want to go into pharmacy school. So that's what I did. I worked on it for a while. I had the rough draft like done pretty early on, and then I would just kind of send it to my professors, my friends, people I trusted to look over it and tell me what to change and stuff like that. I would say kind of be not open to criticism, but you know, be more open minded if people tell you, oh, change this, do that. Like, don't. I think I used to take it a little bit personally, like, oh, my writing isn't good, but it's really not like that. It's kind of just some people have different perspectives of looking at things. So when you're sending someone your personal statement to overlook, you want to make sure that you're like you're taking their recommendations into consideration, kind of. So for the PCAT, I took it early on because I first took the PCAT and I took it the first time. I took it, I was still in like, I think I was 2nd-year undergrad. I hadn't even taken Orgo 2. So the first time I took it, I didn't do so well. I hadn't taken like maybe 3 or 4 of the classes that are required for the PCAT. So I kind of want to just get a feel of like the test and like see how it was like. I didn't do as well as I wanted to do, but then I gave myself enough room and enough time to retake it and still like make it in time for the deadline. So then when I retook it the second time, I did pretty well, and I applied with that score. And so when you're planning to take the PCAT, it's only done in certain time frames. So make sure that when you apply, you look for, give yourself at least 2 cycles, or not 2 cycles, like maybe like 2 times to where you can take it. Like I think they offer in the end of June or July, I'm not sure. They might have changed it since I took it. And then I'm pretty sure they offer it again in September. So I would kind of give myself that time frame because if I don't do well, I want to retake it and still apply in time to make the deadline for Wayne State or whatever school you're going to apply to. And then I submitted my application early September. So I think the deadline for early admissions was September 5th. And it's kind of funny. So don't be like me and don't procrastinate. I literally submitted my application September 4th because I didn't realize that to get your transcripts at Wayne State, you have to like pay your tuition and do all that kind of stuff. And I was kind of late doing that. So it was like stressful in that situation. But once your application is in before the deadline, you should be fine. And for early admissions, you hear back within like 2 weeks. It's really, really quick. I kind of liked it because you're not sitting there waiting like, oh, did I get in? Am I going to get an interview? Like what's happening? So I submitted my application early September. I heard back, I think like 3 weeks later that I was due for an interview early October. And then after the interview, they said it takes like 2 weeks. I think it took like a week. And they sent me like the you're accepted email, which is always nice to get. So yeah. So I'm going to talk about a day in the life of a pharmacy student. So right now with COVID going on and stuff like that, everything's moved to online. We do have to go to class sometimes. We have to do like we have compounding labs in class that we have to attend, shadowing our mentors, which is required for us. So every in pharmacy school, when you're a P1, they pair you when you're like in year one, they pair you with a year three student. So they kind of, based on like where you live and like your background and stuff, they kind of pair you with someone kind of similar. So when they become P4s, so when I'm in my 2nd year and she's in her 4th year, she goes on rotations. You have 7 rotations, I think, in your P4. So your last year of pharmacy school is just all rotations. You're not even like in class at all. So you're required to go with her for one day on her rotations, on every rotation, so 7 times basically, and like experience and see what she does on her rotation. So you kind of have a feel for it. So that's when I'm required to go in, and we go in for compounding, and we go in for we're placed in like underserved clinics that we have to go to and interact with patients and stuff. So we go in for that. Other than that, our exams are online, classes are online, everything else is online. So all our classes are done through Zoom, which you guys probably know. So we have a lot of like case studies, or we'll do like TBLs, which is team-based learning, where they kind of put you in breakout rooms and they give you a case and you have to discuss it with like the people in your breakout room. And then we do like polling questions where the professor will ask questions and you have to like poll it in and send your answer in. Some of the classes we have are asynchronous, so we don't have to like attend in class live, but we have to watch like the PowerPoints or whatever lecture they recorded before. I know for med students that their classes aren't required, but for pharmacy, every single class is required, and they do take attendance, so you do have to show up. And like when you do the polling questions, those count as like your attendance. So make sure you do those on time and like try not to miss any. Um, so I don't want to scare anyone, but pharmacy school is not as it's not it's not as easy as they tell you it is, but it is a lot of work. I would say I study an average like 5 to 8 hours a day. I remember when I got in like my P1 year, it's like a huge change from undergrad. It's, to be honest, I don't think it's comparable. Undergrad is a lot like less stressful, and like it is a little bit stressful obviously with exams and stuff like that. But with pharmacy school, like you don't have days off. You don't have like a full day where like you don't study anything or you don't do anything school related. Obviously when you're on like winter break or whatever, that's different. But during the semester, it's extremely time consuming. You're studying every day. You're constantly trying to review material before and after class. So you're kind of studying like 24/7 basically. Um, I remember during my P1 year, I like straight up didn't see my family for like a good, like a long time. It was a lot. Like I was in school from like, we had classes at like 8 a.m. So I would be at school till like 7 or 8 p.m. And like I would go home and like maybe, I don't know, watch a movie or something and then go to sleep. But like I'd be studying that entire time, or like just trying to catch up on material. Because if you think about it, like you are going to be the expert on medications. You're going to be the person that should know most things about medications that almost like people around us. I'll talk about my own family. Like my mom is on maybe 3 to 4 medications. My dad is taking medications too. Like everyone around you is probably on some sort of chronic pill, So the average person is usually on like the average person walking the street is taking usually like something. It's either like an OTC, an herbal supplement, a vitamin. So everyone around you is kind of taking something that you should be an expert in. So it does require a lot of learning and a lot of memorization. But I don't want to scare anyone. It's not like you're memorizing like books and pages. You just got to know, like they break it up for you where it's kind of you're like memorizing the things that are important in this section, and you're focusing on this section right now. And obviously with technology and stuff right now, we do have like a lot of databases where you can just go online and search up the medication that you're looking for. So I think back then, they were required to probably memorize a lot more than we are, just because like when you're in the hospital setting, you can easily search up like, oh, does this drug and drug interact? And that's a very easy find to find, but you should know like the overall thing, because you're not going to be searching up everything. So that's why it requires a lot of time and like effort to study the stuff. Like I said, attending underserved clinics. So the school places you at a clinic. So I'm placed at Cabrini Clinic, which is in Detroit. It's one of the, I think one of the oldest underserved clinics in Detroit. Yeah, so we're required to go in 4 times a semester, and you kind of just see patients, get their medical histories, do that kind of stuff. So, and then I said shadow your mentor on rotations. So for me, I shadowed my mentor a couple months ago on her ICU rotation, and that was really intense for me to see because the ICU in Beaumont is it's no joke. It's pretty like I didn't expect it to be this fast paced, but like when we got there, the attending was there. There's a whole round of like 10 to 15 people rounding on each of these rooms. And the pharmacy student actually has a huge role and like the pharmacist on these attending on these rounds, sorry. So they'll ask you questions like what medication is he on? Is he on the right medication? What's the dosage? Should we change it? Should we give him something else? He's clotting right now. What do I do? Like all that kind of stuff, that's on you. Like you should know that. The doctor focuses a lot on like the diagnosis, and they do focus on medications as well, but they'll kind of like a lot of times they'll be like refer to pharmacy. They won't even write it. They'll just give it to you and be like, okay, this is what this patient's going through. What do I put him on? What's the best thing? There's these 3 different types of like blood thinners. Pick one. Which one's the best one for him? You know what I mean? So that's your part in this. Um, on the shadowing rotation, I went with my mentor. It was I remember we got there and there was like a patient who like literally just started bleeding out everywhere. Like there was blood all over the floor. I don't know what happened, but like everyone was like running, and it was literally like a scene from a movie. It was pretty intense. And then there was another patient who like ripped out her like breathing tube, and they had to like go back and put it in her. Another patient who like tried to like, I think he was suicidal or something, and like it was a lot. So being in that kind of setting is also like, you wouldn't think a pharmacist is involved in it, but once you see it, you see how critical pharmacy is to that kind of setting. um when I'm done studying, usually I'll take like a walk, or like I'll go work out or spend time with my family or stuff like that. On the weekends, I do like to kind of not study as much. I'll maybe do like 4 hours a day in the morning, and then kind of take the rest of the time to, just relax or do something that I really enjoy. Um, I think it's super important to like focus on your mental health even when you're in a professional setting. I remember during my P1 year, I like didn't take any breaks. I was really scared of not doing well, and I was really like, I have to like in I know in med school their grades don't really matter as much. Like when you're in med school, you just have to pass your like exams. But in pharmacy school, your GPA does matter. So when you apply to residencies, pharmacy, there's residency year 1 and 2. So if you want to be a clinical pharmacist, which is like a specialized pharmacist in the hospital setting, where you're not just like verifying medications, you're actually like going to the patient's rooms, and you're doing like, you're on rounds, or you're on infectious disease rounds, you're involved more in like that kind of setting. You are going to have to do a PGY1, which is a pharmacy year, like a residency in your, like a 1 year residency. And then if you want to get even more specialized, there's a PGY2, which is like 2 years of residency as a pharmacist. So when you're applying to those programs, it's basically based on like your GPA and what kind of activities you did in pharmacy school. What were you involved in? Did you have an internship? Are you a well-rounded student? That kind of thing. So I think that's why a lot of people have like a lot of pressure during pharmacy school to do really well. But I think it's still super important to like take time off a little bit, because like I said, in my P1 year, I was really like, I was very involved in like, I thought grades mattered a lot more. But once you take time to just not constantly study and just kind of take a breather, you actually end up doing a lot better. I was doing a lot better in my second semester, and like this year right now, P2 year, which is supposedly our hardest year, because I'm taking time to just not constantly study all the time. Your brain gets fried after a while anyways, so you have to kind of just take that time to like dwindle down a little bit. Okay, I don't know if anybody has any questions before we get into the case study, or
You guys can unmute yourself if you have any other questions regarding her journey or anything like that.
Can you quickly talk about like the pharmacy school curriculum at Wayne State University?
Yeah, sure. So in our first year, you're basically doing nothing pharmacy related. First year is more like you have like pharm sci, which is kind of like a chemistry based class. I like I said, I hate chemistry. I was so bad at it, but they kind of teach it in a way where it's not orgo where you're learning reactions and stuff like that. You're learning structures of molecules that are involved in like the most common drugs. So there's that. You're also taking a pathophysiology class, which is just like the anatomy of the body and like disease states and stuff like that. What else do we take? We took like SAS, which is like a social administrative social sciences class, which is kind of like, how pharmacists are involved in the community and what you can do as your part and like how to maintain professionalism. We do have a class called pharmaceutics, which is kind of learning like the science behind medications, how they're manufactured, how they're made, the bioavailability of them, like the actual structure of the medication. So you're not learning specific medications in your first year, you're learning more of like the overall picture kind of thing. So during our first year, we literally had we didn't learn about any like drugs at all. We learned just more of like the overall picture of it. That was first year, first semester. Second semester, you have your first module. So a module is like where you're actually learning about medications and disease states and like if someone comes to your pharmacy and they have like a wound or a cut, what do you recommend to them? That kind of thing. So second semester, we got a little bit more exposure to medications. But yeah, first year is more, it's they call it like kind of like your prerequisite year where you're just kind of learning like the overall body and like the overall picture of it. It's not heavily focused on pharmacy. Your second year, which is what I'm in right now, is extremely focused on pharmacy. You have a lot of we have, I think, 2 modules right now. We're doing cardio and we're doing endocrine. So cardio is like all the cardiovascular drugs, all like the endocrine drugs, women's health, men's health. So we're learning about like birth control, the 500 different types of brands of birth control, like what's in each, like what does estrogen versus progesterone do? I don't know if you guys know this, but like there's different types of people that can take certain birth controls, different types that can't. So we're learning about like the cardio medications, all that kind of stuff. So second year is very, very, very heavily focused on pharmacy, and it's the bulk year where you learn almost everything you need to know about pharmacy. And then second semester, I believe we're doing, I think it's neuro, and I think like I can't remember what the second module is, but we're doing another module in our second semester, sorry. Third year, you're half rotations, half in class. So I think it's like 30 hours of rotations where obviously like Wayne State is going to place you somewhere. You can either be in a hospital setting. I know someone who's in Beaumont right now. And then I know friends of mine who are at like Walgreens or CVS. So they place you there. I'm pretty sure third year is more retail based, like very community based, because in your fourth year, it's all rotations. So you're not in class at all. You don't go to school at all. You're just going on your rotations, and you can pick, there's 3 different ways that you can go. You can either go fully community, so you can pick to just do all your whole entire year. It's like a 12-month thing at like a Walgreens or a CVS or whatever you want. And then, or you can do a whole hospital-based setting only, where you're only at like a Beaumont or only at like St. John's or only at like a hospital setting, or you can do a mix of both. So you'll have half hospital, half community, and you kind of go based on what you want to work in, I guess. So a lot of the people I know, like my mentor, for example, she's doing like the fully hospital setting only because she really wants to work in a hospital setting when she graduates. I know a friend of mine who is doing only community. She loves like CVS, Walgreens, and stuff like that. So she wants to go into that setting. So that's what she did her rotation in. And then I honestly don't know anybody who did like a mix of both, which I think would be a good thing to do just because you get exposure to both. But the thing is, a lot of people pick retail or they do like a CVS or a Walgreens because the pay is like higher. So as a retail pharmacist, you would think a pharmacist in a hospital would make more, but as a retail pharmacist, you make more money than a hospital pharmacist would. So that's why people pick that. But then again, it's kind of like what kind of job / quality of life do you want to have? Do you want to be in like a retail setting for the rest of your life, or do you want to be more clinical based in a hospital? It's just what people prefer. So that's kind of like the overall curriculum, I guess, of pharmacy school.
Awesome. Okay, so there is less than about 20 minutes for the session left, so I think we should start the case study.
Okay.
If we have time for your questions, we can ask them at the end.
Okay. So this case study is a patient that I interviewed during my med history at my underserved clinic. So basically, JH is a 58-year-old white male. That's his height and weight. And he came to the clinic with he reported 10 out of 10 pain in his lower extremities, only occurring at night for about 30 minutes to 1 hour, and it started about a year ago. So as we can tell, like early on, he's obese. So he, like, the history of his present illness is like why we're here today. So he reports he lost his prescriptions and medical insurance coverage, why he's at the underserved clinic. He reports his home blood sugar readings have been 160 to 180 in the morning before meals, and he has Charlie horse pain in his toes at night. So Charlie horse pain is more of like tingling sensation pain. So he has type 2 diabetes and fibromyalgia. So his social history, he has no tobacco, no alcohol, no recreational or illicit drug use. So his family history wasn't significant for this case. So his medication history. So as a pharmacist, the first thing you want to know, or the first thing you should be looking for, is what medication is he on, and is whatever he's experiencing a side effect of his medication? And if it is, how can I change that, or how can I adapt that? So he's on metformin, 1,000 milligrams twice a day with meals. He says he's 100% adherent, so he takes it all the time, but he doesn't always take it with meals. Metformin is a diabetes medication. And then his glyburide is 5 milligrams daily in the morning before breakfast, also 100% adherent. It's also used for diabetes. And then gabapentin, 800 milligrams 3 times a day. He's also adherent 100%. Gabapentin is it's used for neuropathy and like pain. So for over-the-counter medications, he's taking Aleve once a day. He usually takes it if he has like really, really bad pain. So it's not like every single day, it's as needed pretty much. So the vital signs on the day he was seen, his BMI is listed there. He's obese, his heart rate, his blood pressure is 150 over 86. So normal blood pressure should be around 120 over 80. So his blood pressure is high. And then his oxygen is right there. His pain, he said, was 10 out of 10 in his lower extremities, especially in his toes. So his fasting blood glucose level was taken. I don't know if you guys, diabetics usually have like a little, it's called like a glucometer, where they just inject themselves, they prick themselves, and then a little bit of blood comes on their finger, and they just, they put it on their glucometer, and it tells them their blood sugar. So his glucose was 165, which means he is diabetic, which we know. And because he was a new patient, we weren't able to get any other lab values. So when coming up with a therapeutic plan for this patient, you want to find the number one priority drug-related problem. So I thought that his number one priority problem was his uncontrolled type 2 diabetes, because before I get into the goals and stuff like that, it's very common to have diabetic neuropathy, which is the tingling sensation in his extremities, so his fingers, toes, that kind of stuff. It's very common to have that when you're a diabetic, especially if your diabetes is uncontrolled, which we know it is because his fasting blood glucose is 165. So clearly his medications aren't working for him. Or if they are, he's either not adherent as he says he is, or he's not taking them correctly. So once you solve his diabetes and it being uncontrolled, so once you get that under control, usually his pain should subside and it should be okay. So my goal is to achieve lower glycemic, to make sure that he's adherent to his medication. And if he is, to switch him over to something that could work better for him. So once I take care of that, then his pain should be okay. So the goals are listed right there. And then for the treatment plan, the first thing as pharmacists we want to do is we don't want to automatically think of just first thing is like giving medications. No, we want to make sure that the patient has non-pharmacological treatments as well. So in ways to lower his diabetes is to lower his weight and to get him to be more active. So what we do is that we'll, educate the patient on, hey, it's really important for you to go out and take walks. It's really important for you to eat more healthier and more balanced meals. It's really important to get your heart rate up and to recommend him to do physical activity 3 to 5 days a week. Because a lot of these medications, they do work, but they work a lot better if you're doing your part and you're kind of, doing your part in like exercising and eating healthy and eating better. I know with COVID and like what's going on in the world right now, a lot of people are stuck at home and they don't really have the luxury of like going out if they have like underlying conditions, or going for a walk, or going to the gym, or anything like that. So we do want to make sure that even if you can't like go out and you can't do something, at least take a walk around your house, take a walk around the neighborhood, So we want to educate the patient to do that 3 to 5 days a week. And then we want to limit his carb intake. So we want to make sure he's eating like a more vegetable protein diet than carbs. We want to continue his diabetes meds as prescribed, and then we want to initiate this new medication, and we're going to add a new medication because clearly his other medications aren't working as well for him. So this is when I would initiate like a third line agent in this case. I want to discontinue his Aleve, which is an over-the-counter medication because it does interact with his other meds. And then if his pain is still like really bad, I would recommend Tylenol over the counter as needed for his pain. But usually when I like in this case, we didn't act like this is our case study that we had to do in class, so we didn't actually tell the patient this. But I mean, he was at the clinic, so they probably gave him the same recommendations we did. Usually in this case, if he isn't like if he does take this third line agent and he still has this pain, then we would refer him to like a diabetic specialist so we can see what exactly is going on, because in combination with non-pharm therapies and these three medications, it should be under control a lot more. But we also want to make sure that like this patient, for example, because he lost his job and doesn't have insurance, whatever I'm recommending, I want to make sure that he can get it at the clinic. So as a pharmacist, it's also my job to make sure that patients are on the most cost-effective treatment that they can be on. I wouldn't recommend him something like insulin, for example, because insulin is extremely expensive in the States. It's really hard to get. A lot of these underserved clinics don't have access to insulin. And if they do, he'll have like, maybe they'll get like a stock for a month and he'll get it. And then the next month they won't have it. So why start him on a medication that he can't continue or he can't afford or anything like that? So it's my job to find something that works for him, but it also works for his lifestyle. So that's why I would initiate this kind of treatment. So for monitoring plan, we want to make sure that he's, testing his blood sugar and making sure it's under control. We want to make sure to monitor signs of hypoglycemia. So if your blood sugar falls too low, it's actually not good. You can get sweating, tachycardia, and hunger. So those are kind of signs and symptoms of that. It could actually be extremely unsafe if he's hypoglycemic. He can go into shock and confusion, and it could possibly lead to death. So you want to make sure you educate them on these types of signs and symptoms. So we want to tell him to make sure to take his metformin on time and to take it with meals for maximum efficacy. And then we want to follow up after a month at Hood. This was at Hood Clinic. So we want to make sure that he follows up after a month. And we want to make sure when we take his like his blood, his lab values next, we want to do like a full complete lipid panel and a complete Chem7 panel. So like his sodium, potassium, all that kind of stuff to make sure that his medications are working for him. And then that's it. That's the end of the case study. So
Is there ever a case where the pills might not work and he would have to use insulin?
yeah, a lot of people are like when they don't their medications don't work as well, like it depends on how high his blood glucose sugar is. So there are cases where like a lot of people where I work at my pharmacy, we have a lot of people on insulin. So yeah, it could happen. This is just an example of a case study. Like as pharmacists, I feel you see a lot of different people. Like at one of my other clinics that I went and did a med history, we had a psych patient who had just got out of rehab, and his story was actually really sad. So he was suicidal and like he lost his job of 30 years after COVID, and like he couldn't function with life, and he was like he was on cocaine I think for like 3 years, and like he just got clean. So you see a lot of different types of patients, and a lot of them need different types of things. So he's on an anti-psych med, and like he told us, and like psychotic medications and anti-psych meds are really expensive. So if he runs out of it, or if he doesn't like have his medication, he'll actually go into like he'll start using again, or he won't be in his right mind, or he'll go back to cocaine or whatever. So you want to make sure that he's getting his medication on time, he's taking it on time, he's taking it correctly. So a lot of it does have to do with physical health, but a lot of it is also like their mental health and making sure they're okay and they're getting the correct medication on time as well. So you see a lot of different people.
Would you say like if the patient was able to afford both the pills and the insulin, is there
Mhm.
ever like a preference between the two?
It depends on, well, metformin is like first line agent. So anyone with a high blood glucose, you would want to give them metformin first because insulin is, you inject insulin, so it's like a needle. It's not necessarily first line like treatment, so you don't want to give them that first thing. So pills are for sure like definitely preferred over insulin. But then if they're not responding to the pills like this patient, or they're not fully adherent, or they forget to take their pills, you would want to start probably initiating something like insulin. But then again, it depends on like their lab values and stuff like that. So
Awesome. Does anyone else have any questions for Selma? Could be about the case study or her journey, anything like that. Welcome to ask now.
Okay, so what does metformin do in the patient's body? Like, how does it reduce blood sugar level?
oh, you want to like the mechanism of action of metformin?
Yeah.
That's a good question. I actually don't even remember what the mechanism of action is, to be completely honest with you. I'm pretty sure it interacts with like the glucose receptor. So people with type 2 diabetes are insulin, they're not completely insulin resistant. So type 1 is when you're insulin resistant, like your body literally does not like it doesn't produce insulin. So you're a lot of them are like a lot like really skinny, and like they show signs early on, and someone has type 1 diabetes when they're really young. Type 2 diabetes, you usually, when your BMI increases and your waist circumference increases, that's when you would start like that, like those are signs and symptoms of people with type 2 diabetes. It's really rare to find someone with type 2 who's who's in their normal range of BMI. So metformin's mechanism of action, to be honest, I like don't really remember. I know that it interacts with the glucose receptors, or sorry, the insulin receptors on the body, and it lowers blood glucose sugars or blood glucose levels. The exact mechanism of action, I could probably search that up for you, but like I don't know at the top of my head, not yet at least.
That's okay, thank you. I have another question. So like, what was your science GPA, like your prerequisite GPA, and how do you handle burnouts during pharmacy school?
What was the second part? How do you handle what?
Burnout.
I'm sorry, I think it's cutting off.
So how do you like handle burnout? Like, you know how you get stressed out during pharmacy
Oh, like
school? How do you
burnout?
like
Yeah.
manage that? Yeah.
Okay, so my science GPA, I think it was like, I want to say a 3.5, I think so. I'm pretty sure. It was like 3 years ago. I don't really remember the exact number. My overall GPA was a 3.69. I graduated, like I finished my undergrad with a 3.69. Pretty sure my science was like a 3.5. Honestly, for burnouts, what I do is I really, really like working out. So if I am just getting like overwhelmed with everything, I will go to the gym and just like work out, or I will like take a breather and say, okay, for the next like half a day, especially with COVID right now and like classes being online, just staring at a screen for 9 hours a day hurts your eyes, hurts your head, hurts everything. So when I feel myself starting to like reach maximum capacity, that's when I'm like, okay, I need to close my laptop, I need to put my phone away, I just need to like kind of exist in the world for a little bit, and just like not forget about school, but just kind of put it on the side for just a little bit, and just do something that kind of makes you happy, something that uplifts you. I also really like baking, so I'll just, I don't know, go bake a cake or something and just eat it, or I don't know. I know working out and baking don't really go hand in hand, but yeah, just kind of do something where you kind of take your mind off of it for a little bit.
Okay, thank you.
You're welcome.
Are there any other questions? Okay, so thank you so much for the incredible and insightful session, Selma. I really enjoyed how interactive and engaging you were, and I hope you have to hope us have you. Sorry, I hope to have a session with you again in the future. If you would like to post your social media handles or any links to your business endeavors in the chat, please feel free to do so. To our Wayne State students, please make sure you complete the Google survey posted in our Zoom chat summarizing the session, and to obtain your shadow hours. Thank you all, and I hope you have a great day.
Thank you, Jessica. It was really nice talking to you guys. Thank you so much for having me. I can post my email if you guys want. I don't use social media, to be honest, so don't really have that. I have a Facebook, but it's only for like school purposes. So if you guys have any questions or anything, feel free to email me, or you can, if you find me on Facebook, just add me and ask me whatever you want. I'm pretty open, so.